was just me, it was my mom, 4 of us, my mama, my middle brother, my sister, and my baby brother, and my grandma. So my grandma, she raised us as one. So when we had fun times. Yeah, my family pretty amazing. Had a good childhood, you know, friends, family, very supportive of me, you know. When they found out we had disease, me and my brothers, you know, they basically took care of us. Sick, had our back 100%, you know. When we need something, neighborhood was there for us.
My expectation was that I was going to meet a man who was inpatient a lot, that I didn't know. In my heart of hearts, I knew that I was going to do something to change his life.
When I first met Karen, I was already mad because the situation I was dealing with the other people. And she came in and she looked. I told her, I don't want to talk to nobody right now, so you can leave. I don't want to talk to nobody. So she said, okay, I'm just gonna go. So I was up under the cover. I never took my head from under the covers because I didn't want to talk to nobody because I was already upset and in pain. I didn't want to talk to nobody. So I happened to hear the TV click. So I was thinking, like, who is in my room? I get from up under the covers, and she said, oh, it's me. I wasn't going nowhere till you talk to me. I said, okay, well, let me talk to this lady so she can get out of my room. And ever since then, we've been talking, and she's been in my life ever since then. So, and I think if I go back to that day when I was sick, I probably have to say I apologize for that. Because, like I said, she saved my life. She saved my life. She looked at me and saw not only a patient in the hospital getting his pain medication or getting his IV fluid, she saw something in me that was hope.
We had a very good conversation about what brings him into the hospital, about pain control, about quality of life in general. And, you know, he was ready to make some changes, and I left some information for him to read, and he really called me after that and discussed, you know, the information I had left him, and was pretty ready to do some changing.
When me and Karen sat down, she ran through the papers with me. We read what methadone was, you know, what it was used for. So when I finally got the medicine started, that day was just wonderful. Hospital visits got lesser and lesser. Emergency rooms got lesser. The stand visits got lesser. Only time I go up there now is for my appointments to see other people. Physical challenge that I face, my most big worries is about these challenges I face is as I get older, I wonder, the disease going better or is it going to get worse? And I do want to live a long time for my son to make sure he have everything in life if something do happen to me. And the big challenges we have is basically when the weather change up, we got the knees hurting, the arms, the back. We got to worry about the chest problems and all that bad stuff. But the most challenging part I think about is being hospitalized and being away from your family for a while. When you're in the hospital, that's the most challenging. And just that getting IVs and just getting stuck all the time, that's the most challenging too. But even though I go through all that, I still keep a smile on my face, you know, because I want to help other people with this disease. No, you got a disease, but don't let it stop you from doing what you like doing.
When I was working with Antwan, there was many challenges that we faced going forward. One of them was to have Antwan dedicate, engage. You know, he needed to own that he's part of the fix. So getting him involved, getting him to call me, to talk to me, to build that trust. And we knew that was something that was not going to be an overnight fix. You know, so we did that, you know, we accomplished that in a relatively short time. But then we also faced having the healthcare team be on board with us as well. Every time you're in the hospital, you know, you're the guy he was the man under the covers. It was Antwan in a dark room with a blanket over his head, and that was every time, and not listening. And so we had to change that. We had to change the mindset, and once Antwan changed his mindset, we could have the healthcare team also change. He's now open. He's no longer under the blanket. Plus, he still had his life to live. You know, he still wanted to play basketball. He still wanted to hang out with his friends and, you know, his family. While he was still trying to do these changes, he still had a life to live.
Karen actually came in there a while back when I was sick. And when she looked at me, she said that I see a person, I see somebody inside you. And every time she came around, she said, it's just a glow about you that I like about you. So when I said, okay, I told her, yeah, usually I said a lot of people say that, but you know, I don't get that glow part a lot. And her goal was for me was, if she can keep me out the hospital and continue with the methadone program, we're gonna have a long-time friendship. And we've been friends ever since, and that was the goal, to keep me out the hospital, take care of my son. 4 years, that's the longest I ever stayed at the hospital. And I'm working on more years.
We both had the same goal in mind, is to improve his quality of life. Not to have him be in the hospital all the time. He was missing out on most of his life by being inpatient. So that pain control and improving his quality of life was essential to the goals. That was the only goals we had at that time.
My health improved and managed health a whole lot better than it was before I had managed health. You know, medication problems, that's gone. I ain't got to worry about that no more. They pay for medication on time. I can get the medication anytime I need it. The insurance is great. So if I have to stay in the hospital more than 3 or 4 weeks, I'm good. I ain't got to worry about the doctors, oh, you got to come in, or we got to send you home because your insurance up. You got to worry about that no more. That's one thing why I like managed health a whole lot.
With Antwan, our short-term goals have already been successful. We've already achieved success in that. Long-term goals, how will I know that when we've achieved that success? It's going to be hard to measure. When he's involved in school, when he is walking with his son and to school, when he is able to maintain a good quality of life and give back to the community, maintaining pain control. I mean, all of that is going to be indicators of our success.
Managed health program is amazing, and I love it a lot. So I wouldn't go with no other HMO, no other, and I like it a lot.